The first 1,000 days of life is one of the most important developmental stages for a human and their family. And this stage simply has not received the type of investment, care, and intentionality that it deserves. And we are witnessing the downstream consequences of this decision. The Upstream Initiative is changing this in Oregon. In this video, Kari Lyons with the Already Network talks about some of what they have achieved in this space.
We're the Already Network. We formed back in 2018 as a sort of innovative project within the Health Share of Oregon. What was really missing in the region was kind of the cross-sector work where, you know, we have a family, for example, who's navigating a complex web of services, and they might go in and, you know, have one person for their labor and delivery process, and then they have a child and they have a pediatrician, and then if that child has a special need, then they move to, you know, all the referral agent and all the referrals of behavioral health or physical or occupational health, and then they're with the schools around special education, and then they have culturally specific supports, and then maybe they have social need supports. And so what happens is that now that family's sort of continuum of care team is, you know, 16 to 20 people that aren't necessarily talking to each other. And so the onus is on the family to navigate all of these relationships so that they're getting their child what they need. As a part of the network, we're saying that the onus really needs to be on the system to be all ready for the families rather than the family having to navigate this complex system. So it's really important to us that we center family voice. We brought in family advocates, community health workers, home visitors, and we did an entire day of a convening where we heard from them, and we did journey mapping. What is that trauma-informed, sort of anti-racist informed continuum of care for these families? So what's happening in the system? What are the feelings coming up for families? When we did journey maps, it wasn't just the transactional piece of I went here, I went here, I went there, but it was like, I experienced racism here, I had harm here, this was said to me here, this is why I didn't go back because that was said to me here. And so we really mapped not just the service delivery model, but the emotional and physical journey that families were going through. What it means to be already, and this is very similar to OHEC's, you know, kind of vision and communication, is like, does a family have the capacity and tools to be their child's first teacher? Are we actually reducing disparities? Are we ensuring that children have an access to affordable, safe, and stable housing? In what ways do we value parents as their child's first teacher and consider individual difference in language and culture? You know, is childcare affordable for families, right? So this is what it means for the system to be all ready.
Keep in touch with the Upstream Initiative and the Oregon Health and Education Collaborative by subscribing to the YouTube channel, signing up for our emails, and following us on LinkedIn.